Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Did you realize that the largest provider of pediatric health services in the state right here is in your own backyard? Cohen Children's Medical Center in New Hyde Park serves as New York's largest Level 1 pediatric trauma center and wants you to know that they are a destination for pediatric emergency care. My guest today is Dr. Matthew Harris, a doctor who specializes in pediatric emergency medicine and medical services with Northwell Health at Cohen Children's Medical Center. Dr. Harris, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thanks. It's a pleasure.
So, Dr. Harris, you got to tell me a little bit about yourself and what made you want to become a pediatrician specialist.
So I have grown up in a family of lots of young kids, and I have very, very fond memories of my community pediatrician up in Rockland County, New York, and really found a great deal of inspiration both in my pediatrician and also my father, who's a physician as well, and was just naturally inclined towards pediatric care. Pediatric emergency medicine was an opportunity to provide care to some of the most critically ill and injured children, while also having a moment to talk about, poor feeding or dehydration or diarrhea. So you get to bridge the gap between primary care and critical care, and it's something I find very rewarding.
So when you're talking about pediatrician, what is the age range that we're really specifying here?
So in the pediatric emergency room at Cohen Children's, we most typically see children from birth, so 0 all the way up through their 18th birthday, though there are some slightly older adolescents and young folks that we will see who are followed by some of our subspecialists, mainly those with certain types of cancer, neurologic diseases, but predominantly 0 to 18 years of age. Yeah,
no, I had a pediatrician and they had to kick me out of the office. I just love my pediatrician. He just said, listen, no more of me, move on. But yeah, so you get kind of really, akin to your pediatrician over the years. So tell me about the history of Cohen Children's Medical Center.
So Cohen's is a really special place, right? It's coming up, I believe, on the 40th anniversary of the Children's Hospital, previously known as Schneider's. I think it became Cohen's just over a decade ago, through some really wonderful sponsorship by a family that just has really changed the face of pediatric care, in the area. So Cohen Children's, as you discussed, is, a large tertiary center for children. There's really no disease or pathology that we can't provide high quality care for. We are the largest level 1 trauma center for children in the state of New York, and we care for about 1,500 injured children per year, and somewhere in the ballpark of 70,000 children cross the doors of our emergency department. And that certainly has been the case in the last several weeks. But it's an incredible place with intensive care, with pediatric subspecialties, pediatric surgery. So it really is a place I'm proud to call my clinical home.
So you care for children with acute situations or medical problems as well as chronic issues? Is that?
So certainly the mission of the Children's Hospital broadly is to care for kids throughout their childhood and into young adulthood, from chronic medical issues through more acute issues. Certainly in my role in the pediatric emergency department, we tend to see a higher acuity set of patients, those with suspected appendicitis, right now a lot of respiratory disease, and certainly those who are critically ill or injured. So while we do see some primary care within the pediatric emergency department, we really try to focus on providing care to those who are most urgently in need of it.
Mm-hmm. So your website for Cohen Children says that children you see differently because you approach them differently. What does that mean? What is your approach?
Yeah, so gosh, it's such an important question. One of the things we know is that children experience medical care differently than our adult patients, right? And I think that's evident to anyone who's ever spent any time with children. And how we approach them, how we approach their parents in a compassionate, meaningful way that engenders, I think, a sense of confidence, especially in the emergency department where we have 15 or 20 minutes to gain everyone's confidence and then come up with a plan of care, or for some of the really talented subspecialists in hematology, oncology, cardiology, who have these longitudinal relationships with parents and with these children. We watch them grow up. So I think that recognizing that how we interact with them from the moment they walk in the door, the way the place looks, the way the place smells, the way we approach them in the emergency department, I think is different than other locations throughout the city. So I think it's a place that parents, even during their most stressful moments, feel comfortable.
So tell me about your Bill of Rights.
This is really something that the Children's Hospital is proud of. So, for many years now, there's been something called the Patient Bill of Rights that comes out of something called EMTALA, which is a law that ultimately protects patients' rights to be seen in an emergency setting. It arises out of some case law in the late 80s and early 90s. But several years ago, the Cohen Children's faculty recognized that really there's a different set of needs that children have. They need to understand their care. They need to feel that they can advocate for themselves, that they're being spoken with and not spoken to. And they really do become partners in their care. And that's not a banal statement, right? We really do try to engage, not every 3-year-old wants to get a blood test, but I think how we approach them with our child life specialists, with nurses who really have incredible patience. So that the Bill of Rights highlights our agreement, our contract with children and with their parents and what they can expect from us, and also helps expect, what we can see from them as well. So it really establishes a bidirectional relationship with our patients.
So I understand that there's a lot of specialties that Cohen works with. Can you talk about some of those specialties that you offer patients and their families?
So there's really virtually no subspecialty that we do not offer at Cohen Children's. But I think some of the things that really have been highlighted in recent months is the new heart center, right? So our pediatric cardiologists and our cardiothoracic surgeons who really do everything just shy of heart transplant, which is in the near future. And I think that that really is a marvel that has been built through the support of the Children's Hospital, through many of our benefactors, to provide the highest quality care for some of the most critically ill children we can encounter. But I think that mission is spelled out through our general pediatrics groups, through our infectious disease, the incredible work of our hematologists and oncologists who deal with kids with cancer on a daily basis. So there is no stone left unturned in terms of specialist availability, but really, I think the cardiology team, hemonc, and really the work of our general pediatricians really highlights the mission of the Children's Hospital. So
you do work with children that have cancer, diagnosed with cancer. Is that true?
Yeah, that is true. So there is a robust hematology oncology group here, and those are ranges for people with anemia, with sickle cell disease, all the way through some really challenging diagnosis of solid organ or hematologic or bloodborne cancers. And so I think it's an incredible group of physicians, nurses, nurse practitioners, social workers that really deal with the full constellation of support that these kids need. In the emergency department, we tend to deal with their more acute issues when they come in with fever or some secondary illness. But I think the real lion's share of their care comes from their incredible team.
So what is the most common things you treat at Cohen's Children Medical Center? If you had to kind of
certainly the last several weeks have really highlighted just how important good respiratory care can be for children. So we are seeing record numbers of children in our emergency department, and I think that's the experience of children's hospitals and emergency departments throughout the country. Respiratory illness is always a significant proportion of the kids we see. Right now, it's representing almost 50 to 60% of our nearly 300 to 350 daily visits in the emergency department, and many of them are quite ill. But in a typical day, we will have kids who are injured from car accidents and occasionally things like gunshot wounds, to the more banal but important things like fractures and strep throat and pneumonia. But right now, certainly the biggest challenge has been the volume and acuity of children presenting with respiratory illness.
What do you account for that?
It's an important question. I mean, right now, RSV, or respiratory syncytial virus, is a very, very common cause of colds, and especially has historically and disproportionately affected children under the age of 2, really those especially with prematurity who were born early. This group is a group that was really hidden from society for the past 2 years. I think in the fight against the COVID-19 pandemic, this is a virus that perhaps as we protected them from COVID, they didn't have the opportunity to get exposed in the past and develop some of that innate immunity. It also just spreads like wildfire. And from time to time, we have these outbursts of RSV, though in recent memory, this is the largest volume and acuity of patients that children's hospitals are seeing across the country with RSV. So I think right now it's such an important time to help prevent some of those other illnesses like influenza and COVID, through vaccination. There is no vaccine for RSV, but you can prevent influenza and COVID, or at least hospitalization from those illnesses, by getting vaccinated.
Mm-hmm. You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about Cohen Children's Medical Center in New Hyde Park, a pediatric acute care children's teaching hospital located in New Hyde Park. My guest today is Dr. Matthew Harris, a doctor who specializes in pediatric emergency medicine and medical services with Northwell Health at Cohen Children's Medical Center. What about vaccines? What should all children get them? What is the recommendation there? What about boosters? So talk all about that.
So Cohen Children's, I think, has been a strong advocate for well before COVID for the primary vaccination of children and adolescents against essentially vaccine preventable illnesses. You know, we've seen polio for the first time in New York in almost 3 decades, which is a total vaccine preventable illness. So the routine vaccines for kids, I think most parents are very comfortable with. I think the challenge in the last several years has been getting parents to be comfortable with the COVID-19 vaccine. I have 3 children. They're all fully vaccinated and boosted, so I'll put my money where my mouth is. But other seasonal things like influenza, right now as the RSV surge is just really burning through medical resources in the area, it's just so important to get vaccinated against things like influenza and COVID-19. And essentially everyone can get vaccinated at this point if you're 6 months and older for COVID. So I think, Cohen's really has always been at the forefront to every general pediatrician, whether you are a pediatric ER doc or pediatric critical care, or one of the army of general pediatricians we have, would be a strong advocate for full vaccination.
What do you tell parents who refuse to have their children vaccinated?
This is a tough conversation, but a meaningful one. And I think it's all the more reason why pediatricians and family doctors really have to engage with families on a personal level, right? This is not a paternalistic conversation. We have to show them what we have seen. We have seen kids who have died from measles. We have seen kids who have died from pneumococcal pneumonia, and these are vaccine preventable illnesses. These are senseless deaths. And I think that, we certainly don't want to scare folks into doing things they're uncomfortable with. So we really have to empower them with good information. There's so much bad information out there on the internet and in the community. So we really have to find our voice. We have to be advocates, and we have to empower those families who have experienced loss. And I think we've seen this in a lot of public media recently, where families who have lost children to flu have come out as really strong advocates for vaccinations for flu. So I think we empower them with knowledge.
I think empowering with knowledge is very important. So without naming names, can you tell us a very memorable story for you in treating a patient at Cohen's Children's Medical Center that was very impactful to you or your staff or the family and such?
I think that, there are just so many. I mean, every day is an opportunity to interact with patients and their families in the emergency department. I think when I think back, we've had a series, over the course of the years of, multiple bad traumas that come in. And these kids really do require just an incredible team effort to receive the type of care that they need. And I think back to a young person who came in cardiac arrest from a car accident, had significant trauma to their chest, and it was doing poorly in the ambulance despite the heroic efforts of the EMS clinicians, and went into cardiac arrest just prior to getting to our hospital several years ago. But it was the collaborative work between our surgeons, our intensive care docs, our ER physicians and nurses to perform a very high-risk procedure, which does not happen frequently in the emergency department. This is really something that's for some people, once in a career opportunity. And we were able to resuscitate this child, and we were able to provide not just the clinical care that the child needed, but the support. I think that I think back, looking at it from the room, once the child was somewhat more stable, and seeing our social workers and our child life and our chaplain sitting with the parents and giving them, honestly, equivalently important care about what's happening to their child and providing that kind of support. So I think that there are just dozens of memories I have of the collaborative nature of our work. There is no ego here. There is only the dedicated and sole purpose of caring for kids. And I would bet that's pretty universal in most children's hospitals. And I'm just proud to do it here at Cohen's.
Do you think in general it's easier to handle the illness or death of an older adult rather than someone who's in the pediatric range of 0 to 18 years? Do you think it's easier to handle?
I think no death is easy to handle, certainly for the family, right? I think whether a 99-year-old grandmother who's been, declining for some time, it's a loss. So I think we have to look at these as opportunities to engage parents, right? And those are unfortunate conversations that we have, thankfully, in pediatrics, not with any great degree of frequency, right? I think I can count the number of children in my 10 years here that I've had to declare dead and talk to the parents about it. But I remember every single interaction with those parents. I remember the looks on their faces, and I take that with me. And I think that it's a quiet moment. The ER in the children's hospital gets eerily quiet when there's a loss. And I think everyone knows, parents who are there for more perhaps banal things, an ear infection, a pneumonia. I think everyone kind of knows that something has gone and it hasn't ended well. And it's a powerful moment for trainees. It's a powerful moment for residents and our nursing staff. But I think that one of my mentors always used to say that it's somewhat of a privilege to be there, right? To be there for those parents and quite possibly the worst moments of their lives, and to handle it with delicacy and to handle it with, an intimate capability to be there and deliver bad news, but in a way that doesn't darken the moment beyond where it needs to be.
So how do you recommend a family prepare a child to visit the hospital or to go to the doctor's office? How do you prepare a child without them feeling scared to death?
I speak as a father of 3 here that I'm very candid with my children. They're not fans of getting shots, right? I'm not a fan of getting shots, but it's something we have to do. And so I think for kids who are old enough, 3, 4, 5 years old, I think kids are fearful of the unexpected, right? And they're fearful of strangers. They're fearful of being held down. So I encourage parents, where appropriate, to engage with their children about what they might expect. You prick your finger to check some blood. And why are they doing that? To keep you healthy. And I often tell people and tell my own children that, you might get a shot in your arm. And while that might hurt for a minute, it'll prevent you from being hurt later. So I think engaging with parents, I think also knowing if your child is somebody with special needs, for example, you know best how medical professionals can interact with your parents, so interact with your child. So being an advocate for them, having that open dialogue with your care provider, whether it's the triage nurse in an emergency department or whether it's your pediatrician's office, I think there are ways that we prepare ourselves as a group, not just the child, not just the parent, not just myself as the physician, but how do we engage in a community moment to provide high quality care that's minimally detrimental to kids and the nervousness that they might have coming to the doctor.
So what is the one question that you wish parents would ask once their child is admitted?
What I advocate to parents, especially when their children are being admitted for something that is out of the realm of normal. So, we admit children for pneumonia and bronchiolitis and asthma, but when your child's getting admitted for something like a new diagnosis of cancer or a potentially serious rheumatologic or cardiac disorder, but frankly, even if they're being admitted for a general pediatrics problem, I think what I tell parents is I encourage them to be advocates, right? Mm-hmm. Ask questions. I don't know if this is a specific question you have to ask, but there's a lot of medical jargon we throw around. There's a lot that happens between an emergency department to inpatient admissions, several different teams. You're asked the same question dozens of times in your first couple of days in the hospital. I tell people to write down their questions and ask and interrupt us, right? We like to talk. We're doctors and we like to talk. Interrupt us. Doctor, I don't understand, the issue here, and I need some clarification. Parents need to feel empowered to understand why their kids are being admitted.
And should the parent look at how they feel about how that child feels about the physician and how they interact with the physician? How much should the parent consider in terms of how that child is with their practitioner?
I think that it's a responsibility of any member of the caregiving team. So whether it is the technician who's checking their blood pressure, the physician who's guiding their care, the nurses who really provide the bulk of the bedside management and care, all of us have the responsibility to develop a relationship with kids. And you know what? You can do that with an infant by holding them a certain way. You can do that with a teenager by giving them the respect that they want to have, right? And I think that children should feel empowered. Sometimes they're not in the position to make a decision, right? Sometimes tests are happening that it's not a choice, and sometimes it's something that might be uncomfortable and painful. But I think that patients should always know that we're on their team. And if we're doing something, it's for a reason. And I think that that relationship is so important no matter where you are in the spectrum of care.
is very important. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you are learning about Cohen Children's Medical Center in New Hyde Park, a pediatric acute care children's teaching hospital located there. My guest today is Dr. Matthew Harris, a doctor who specializes in pediatric emergency medicine and medical services with Northwell Health at Cohen Children's Medical Center. Looking at going to see my child, what are the visiting hours looking like these days?
So COVID-19 really challenged us as a children's hospital. You know, we've historically, and I think remain to be, a family-centered place of care, right, where we engage you not just in the conversations about your child's care, but engage you with your child's care. That being said, we've had to temper our open approach with the public health demands and needs of responding to the pandemic. So, currently, when your child is in the emergency room, we allow 2 parents to be in the room.
Oh, good.
It's always an exception if there's another sibling with them. When you're admitted to the hospital overnight, we do go down to 1 parent. That's because we are in a place right now where we are using every available inch in the hospital to care for children, whether it's an emergency setting, the inpatient floor, the ICU. So right now we do ask, that overnight 1 parent does go home and sort of care for the needs at home. Okay. And they come in quite early the next morning. And during the day, we do allow 2 parents to be at the bedside. But right now, children's hospitals across the country are facing just an insurmountable challenge of volume and highly infectious kids. And I think we try to minimize the risk to everybody.
So one parent for 24 hours, can you say that?
No, so certainly in the emergency room, you can have 2 parents at the bedside.
Okay.
2 parents at the bedside upstairs during the day. It's just overnight.
Overnight 1.
We're stretched a little thin. We go down to 1 parent.
So I know you work with Ronald McDonald House of Long Island. Can you tell us a little bit about them and your partnership with them?
Sure. The Ronald McDonald House and the mission really is just an incredible, awe-inspiring program where they provide housing and support for families of children who are expected to have prolonged and often difficult hospitalizations. And these are partners with children's hospitals and other hospitals across the country. The unique relationship between the Ronald McDonald House, which is just a few feet outside the door of the children's hospital. Without it, I think parents would not be able to be there for their children in a way that facilitates, I think, some degree of kindness. Right? I think parents need to shower. Parents need a break. They need a moment to walk away, especially when their children are going to be hospitalized for a long time. And I think having a moment to breathe, having a place to lay down your head and unpack your clothes and feel less transient, I think is really important. And so our partnership with the Ronald McDonald House is really quite important. So
what should parents bring if they're going to stay with their child in the hospital? What should they bring so that they're more comfortable?
Yeah, I think, bring a toothbrush.
Definitely a toothbrush.
We certainly have them here if you forget. But I think the issue more so is that most parents, when they're coming to the emergency room, are hoping not to get admitted. Yeah. I think if you are the parent of a child who's frequently admitted because they have a chronic medical problem or that they have a disease process that will require an admission, I think those parents, they have figured it out. They know the slippers to wear. They brought their comfy sweatshirt. I think, once it becomes apparent that your child's going to stay, I think it depends on how long you think they're going to stay. But I think, we have all the accommodations of home.
You have all the formulas, diapers, all of that.
Bring diapers or formulas. There's plenty of food for parents and families, blankets and pillows. I think it is, I think that while most parents would opt not to have to stay in the hospital, having been a parent to 2 of my children in the hospital, it is certainly comfortable enough for the time you're there.
So you said that the environment is very welcoming to parents and children. What is in the environment makes it inviting? Some people in the listening audience have said, how can a hospital be inviting? Oh my God, it's like the worst place I would ever imagine going to. So what makes your environment so inviting?
I think it's a combination of the people. Right. And the spirit of the place. I think that even in our toughest moments, which arguably we've been seeing in the past couple of weeks, people who take care of children want to be there. So there's an opening, I think, there's a very open sense of community there. I think also when you walk into the children's hospital and the children's ward, these are, even in the intensive care unit, the rooms are bright, there are windows, the walls are painted in a way that the TVs are interactive. So we try to make this we try to make this a continuation of their home life. And especially for kids who are admitted for weeks, months, children with cancer, they can go to school.
Wow.
Right? They can go to school in the Children's Hospital, right? We have teachers who come in.
Oh, really? Oh, wow.
Yeah.
Awesome.
So either in their room if they can't leave or downstairs. I'll just say interestingly that in a local hospital, that's an adult hospital, when they had some extra grant funding and they painted one of their adult wards the way a children's ward is painted, sort of bright colors and pictures of butterflies and
that's nice.
rainbows. That rates of in-hospital depression went down.
Yeah,
that's in the adult world. So certainly that's been the experience we've had here in trying to make this a welcoming environment.
That's nice. So okay, your baby comes in and they're anticipating getting an injection, a needle, a shot. How do you decrease pain if you're going to give that child a shot? Is there anything that you do that's specific to really decrease the pain experience for something like an injection?
So I think parents should know that sometimes, depending on the acuity of the issue, we don't have that moment, right? So if your child's really sick, we're gonna use the most highly skilled nurses we have to try to get that IV on the first time. That doesn't happen every time, especially when they're sick. But I think if we know that it's part of the workup, right? So I need to check some blood work to see if I think you have appendicitis or signs of inflammation in your blood. There are things like a numbing cream that can be put on. If you want to know who the real heroes in our emergency department is, we have a whole group of talented folks in our child life department. And these incredible people are just so talented in the art of distraction and the art of engagement that it's reduced the number of sedations we do, right? When you go in to get a CAT scan, there's now a projector that puts all sorts of like fish and movies up on the ceiling. And now kids go in for what was previously a very, I think, cold environment. And now is, I think, something that parents and patients look back on and say, gosh, that was really, I think, engaging. So I think our child life folks are really one of the most important facets of our emergency department in reducing both parent and child anxiety during their visit.
That's great. So where can we find more information about you? Do you have a website or something that we could go to?
So certainly the Children's Hospital website, which you can link off of. So you can go to www.northwell.edu. If you Google Cohen Children's Medical Center, I believe it's the first one that comes up as well. And I think there's lots of good information about the services we offer. I think it gives some clinical information as well. And you should speak to your pediatrician about how you can engage with our services when you need us. And I think, now more than ever, as we are challenged with the surge of RSV and flu is starting to peak its head, now is the time as a parent to know the resources available to you. And I'm very proud of what we can offer here at Cohen's.
That's excellent. Well, thank you for being here, Dr. Matthew Harris, a doctor who specializes in pediatric emergency medicine and medical services with Northwell Health at Cohen Children's Medical Center. We hope you stay safe and continue to do the great work that you're doing.
Yeah, thanks for having me.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.